Good afternoon, and welcome to the Beyond the Blueprint webinar series. This series empowers health IT professionals with the latest insights, strategies, and design principles required to seamlessly integrate digital tools within their projects. Whether you're embarking on a hospital remodel, constructing a brand new facility, or undertaking a targeted renovation, technology and innovative design are playing an increasing crucial role in helping shaping the future of healthcare delivery. In this series, we explore how to integrate leading-edge technologies and design processes to enhance patient care, optimize operational efficiency, and drive a positive and compelling ROI. My name is Greg Malkery. I'm the Managing Director at Spyglass Consulting. I'm also the host for this series. Joining me is my co-host, Keith Washington, a renowned serial entrepreneur and respected board member at Companions in Courage. Keith, do you have any opening remarks?
Yeah, Greg, thanks a lot. So yeah, just maybe to go back and talk about design, the way we think about design. We think it is something that's all about managing complexity, where leaders in an organization can kind of focus on their mission, that they can be flexible in their plans because it's been anticipated what some of the downstream issues could be, that they can be transparent in their communications, they can overcome a lot of challenges. So that's all part of the theme. I think today I'm really excited about this topic and how it fits into that bigger framework.
Thanks, Keith. Also joining us today is our guest speaker, Dr. Siddiqi, founder and CEO of LiveMED, a virtual healthcare solutions company. Dr. Siddiqi, welcome to our webinar. Would you like to introduce yourself?
Thank you so much, Greg. Thank you for having me. I think this is a great platform to discuss the new innovations and new directions where digital health, healthcare as a whole is heading. I've been myself, I'm Saamer Siddiqi. I'm based out of Chicago. I've been a practicing physician for over a decade now in the Chicagoland area, and started this company a couple of years ago, and it's been a crazy ride so far.
Thank you, Dr. Siddiqi. Now, before we dive into our discussion today, I want to express my gratitude to our valued sponsors, Storage Systems and Simplify Medical. And we're fortunate today to have Lars Anderson from Storage Systems in the studio. Lars, please share a brief welcome with our audience.
This is Lars Anderson with Storage Systems Unlimited. We're a distributor of a number of different storage items, including telehealth carts. Partner with our good friends over at Simplify. So looking forward to a nice education here on how things are developing and where we're headed.
Great, thank you, Lars. Now, during today's webinar, Dr. Siddiqi will explore the future of virtual healthcare within traditional healthcare settings. He'll identify how to use virtual technology to enhance patient care. He'll also discuss deploying digital strategies to improve outcomes and overcoming operational barriers to foster a culture of innovation. Lastly, he'll cover how to implement change management strategies to smooth the adaptation to virtual and hybrid care models. So with that, why don't we get started? Let's start off by talking about systematic design. Dr. Siddiqi, with your extensive experience as a physician entrepreneur, how has LiveMED leveraged leading-edge virtual technologies to enhance patient care?
The biggest, thank you for that, Greg. One of the biggest issues that we had seen in healthcare as a whole is that healthcare as an industry is very slow to adapt to new technologies. And a lot of that is for people to, there's a lot of hesitation with new technologies. There's a lot of regulatory issues and compliance issues. And compliance from a user perspective as physicians and medical providers are really a little resistant to be using new technology systems. So one of the things that we had to try to focus on was how do we make that user experience very, very seamless when it comes to using technology on your laptop, or when the nurses are using some devices or any technologies in the hospital settings. How do we plug it in to their workflows? Because physicians and medical staff and all the ancillary services that are involved in a hospital, they're extremely busy. They don't have even a minute to spare. and then adding an extra layer to their daily workflows it becomes very difficult. And so we had to optimize the workflow and really find those gaps where we can insert this new technology. And then also on top of that, make sure that it's extremely easy to use, very simple to use, and kind of very, when we try to implement it, that it should not require too much training.
Dr. Siddiqi, can you describe some of the unique challenges you have encountered in integrating virtual ICU, hospice, and multi-specialty physician coverage within a traditional healthcare setting?
I can give you a laundry list, Greg, about the challenges that we faced, but primarily
Well, maybe just to identify one or two that might be
exactly. The biggest thing is that, as I mentioned before, hospitals since the pandemic have been a little weary of the word telemedicine or telemedicine technology, and very hesitant to implement that in their systems. And so one of the primary issues that we had was finding those early adopters and new innovators to say, hey, let's give telemedicine technology a shot, and that was one of the biggest things, is get over that hurdle, get over the hesitancy hurdle, and then after that, once we got over that, there's a lot of red tape, obviously. Once we got those approvals, then having the users use it, because there's a lot of times when we hear this hospital or this health system bought this telemedicine technology or these devices, and they've just been sitting there for months and months and no one's been using it. So how do we ensure compliance and using it? And so those were one of the two biggest things, apart from physician licensing and credentialing nationally. That's also another big pain point that the virtual health companies do face.
Have you been able to demonstrate the cost effectiveness of these virtual health technologies?
Yes. So primarily one of the reasons are what we've tried to focus on are rural hospitals and rural small community hospitals, which are already strapped for cash. And what we, in order to make this a value proposition for them, we had to make it cost effective. So the solution has to be cost effective. And then what happens is that you're providing specialty care to these places that initially were not able to provide those services. And so when you add extra services to a hospital setting, that automatically just introduces, more patient retention. They can provide, larger services. It decreases transfers out of smaller hospitals to larger hospitals, which is a big, that's where a lot of the money can go if you're transferring a patient out. And overall well-being of the health system and the hospital, it gets better. The bottom line gets better because they're able to see more patients and treat a wider variety of diseases, basically.
Dr. Can you share a compelling example where LiveMED's digital engagement strategies have significantly improved outcomes and satisfaction?
Yeah, I can share something that early on when we had started, it was a smaller rural hospital on the West Coast. And there was a patient that had been admitted to that hospital. And usual reflex for the physicians that work at this hospital is that if they get even a little bit sick, then they're going to have to get transferred out. Unfortunately for this patient, he had immediately or acutely just decompensated from a heart perspective, from a cardiac perspective. And so everyone was, the whole physician staff was like, okay, let's transfer him out. But then one of the physicians that was on said, hey, we have a virtual cardiologist. Why can we just at least just run it by our virtual cardiologist? So we called the virtual cardiologist, and she had assessed the patient virtually and said that no need for transfer. She put all the medications that were needed to be placed, and that patient did not end up getting transferred. He actually stayed in his hometown, was discharged, and he had a great experience. And that was just the beginning. And since then, we've been helping several hospitals prevent these transfers by providing these virtual specialists.
For the project you just mentioned, what were some of the key factors that contributed to the project's success, particularly in the context of nursing and patient education?
Primarily training from our perspective. We had, before going live at these hospitals, we had several visits, site visits, an implementation team. We had dedicated in-service training for the nursing staff. We established a super user at these hospital sites so that in case there were any issues for using our devices, then they could be the first person to call. And that was, and then we also had some trial runs to make sure that everyone knows how to use it. And I felt like that was one of the biggest factors that led to our success. In addition to the fact that our technology it's very intuitive, and so it doesn't require that much training, but we've still dedicated time and effort to provide that sort of training.
I know in some of our conversations we had in preparing for today, we talked about virtual care and how it's helped post-surgery patients. I wonder if you could share with the audience members some of the key points that we had discussed a few days ago.
Yeah, so when it comes from post-surgical, a lot of post-surgical patients usually end up going home. But some have some issues related to infections or possible some breathing issues. And to be able to address those while they're in the hospital and be able to treat them appropriately, that prevents readmissions because, once they're treated properly after the surgery, they can go home. Let's say if they require some antibiotics and our virtual docs have seen them. But if they, for example, had just gone home without, being seen, then there's a chance that there was something that was underlying and that's what causes them to come back to the hospital. It could be many reasons. So that's why I do believe that post-surgical consultation is extremely important.
So doctor, a couple of just follow-up questions there. So it sounds like, so you as an entrepreneur, early stage business, so you've put together an impressive roster of physicians that can support this virtual care. So I guess tell us a little bit how you did that, because that's not easy. And I guess what are you sharing, or how are they seeing you're giving them access using your technology to this opportunity to disrupt the market? I guess what is their sentiment, or how do they feel about how this is going?
Keith, all our physicians are extremely excited about this opportunity. I've worked in the last decade. I've worked in several different settings. I've had my own groups. I was an employee. I was a partner, a large health system as well. And so I basically took all the best qualities of all the jobs that I've had and kind of made it into one and offered it to our physicians. And so our physicians are actually, it's a physician-owned, our practice is physician-owned, so they're actually partners. And so they have a little bit of stake in the company, that goes a long way. They take ownership and they actually enjoy it. Plus, after the post-pandemic, there's been the amount of physician burnout has become astronomical, and a lot of physicians are looking for other options to provide their services and continue their practice, and a lot of them are turning to virtual care. Specialty care is not is very, very new. Specialties like psychiatry, telepsychiatry, teleneurology have been out there, but the more hospital setting, hospital-based specialties such as cardiology, infectious disease, nephrology, these are some specialties that a lot of them can be seen virtually. And so everyone's been pretty excited of joining on board with us. We've kept a very flexible model. And also the UI and UX that we use for our physicians, it's extremely easy. One quick example that I'll give you is that one of the biggest pain points of telehealth is due to regulatory issues. If our docs are covering several hospitals at one time. And one hospital can be in Arizona, one hospital can be in Colorado, and they all have different EMRs. And so they're already, signing into different electronic medical records for these hospitals. And usually for telemedicine, they're kind of dependent on which telemedicine platform that's at the hospital. So what we did was we actually made it mandatory for all the hospitals to just use our platform. So our physicians are only signing on to one telehealth platform, and all the hospitals just show up on that one platform. And that has actually helped significantly with providing virtual consults and making their life a lot easier.
So everything you just said, I think I want to important maybe to give some context. So you've put together this really impressive roster of specialties that you named, many, which if it's a rural hospital, that's a very difficult thing to do. That's just not a trivial exercise. You put all that together and then you come fully prepared to make it seamless. I mean, that doesn't sound like a startup. You sound like a mature company that's been around for 20 years. Like, how did you come to that?
Well, that's a great question, Keith. I think a lot of it was the fact that when we were starting out, I wanted to make sure that I had the right people involved. I saw some gaps in the market, which were for virtual care. There's too many. There's several vendors. Hospitals have to deal with several vendors. They have to deal with a cart vendor. They have to deal with a device vendor, a telehealth platform vendor, and then they have to contract with other physician groups to get those physicians. And so by incorporating all of that into one under one umbrella, we've kind of made a kind of end-to-end solution that just makes it so much easier for hospital onboarding, that makes it so much easier for hospitals to deal with, and plus because everything is under our system, our company, we can control these variables, and we can get feedback from, let's say the physician said, hey, we don't like this part of this program, can we change it? Or the nurses at the hospital say, hey, we don't really like this technology this way, can you tweak it? We have the capability of doing that because it's our product basically.
Yeah, I mean, it's like you're solving like 5 or 6 problems all at the same time, which is really impressive, right? A kind of a quality problem, a safety problem, a service problem, an access problem, a cost problem, a technology interoperability integration problem. Like that's a really compelling way to look at it.
And so that, I completely agree. And that's one of the things that I wanted to kind of make sure. So our team that we developed from an early stage, we have our technology officer, we have an information officer, we have a very, very strong tech team, we have our chief medical officer who's managing our physician group. So we have everything that, we have physician services that are being managed by our physicians, and then we have tech and implementation and regulatory that's being managed by our information officer as well as our technology officer. And so I decided to just make this team really, really quickly at an early stage because in order to come up with a value proposition, I knew the physician side of it. I knew how to plug it in physician-wise, but I needed to make sure that we were compliant. I needed to make sure the regulatory issues were checked. And also I wanted to make sure that the technology was up to par as well.
Yeah, so like just again, maybe for a beyond the blueprint point of view, you designed an organization for success. You put all that together. That was it. Okay. You had to think. You had to do a lot of thought process to do that.
Yes, I do have a little bit of tech background. I did study computer science in undergrad, so I kind of understood how technology worked, and then I understand how hospitals work, and especially rural and community hospitals, and so I just tried to put in all the pieces where I felt like they would fit, and so far I think they fit pretty well.
Seems great. Thank you.
Hey, Dr. Siddiqi, let's pivot now and talk about overcoming operational barriers. Can you share some specific operational barriers that healthcare organizations frequently encounter when they try to implement a virtual care solution?
Yeah, definitely. So primarily, hospitals are, as I mentioned before, very hesitant in adopting new technologies. So credibility goes a long, long way. And one thing that I wanted to focus on is that any technology partners that we partnered with were extremely credible and already formed, and they have several customers. And so our technology partners, I don't know if can I say that, Keith? I don't know if we're recording, but can I say that?
Yeah, of course.
Yeah.
Absolutely.
Okay. So Simplify are our technology partners, and so they've been in the device, telemedicine device and cart business for the longest time. And so when we go to these hospitals, we have partnerships with a couple of different other telehealth technology companies, digital technology companies. When they're vetting our product, they have to go through their compliance list. They look at these companies who already have a proven track record in delivering healthcare devices and healthcare technology. And so that makes our life a little bit easier because they're not questioning the technology piece, and it's just onboarding of the physicians, basically.
On that note, how is LiveMed, when you're involved with a client, how have you helped create and foster a culture of innovation and efficiency within that organization? Because what you're doing is very disruptive.
As I mentioned, we have a very young team and a very tech savvy team. We have young physicians as well as young technology people, and so a lot of it is brainstorming. A lot of it is trying to figure out, what the best course of action is, and then plus I have a very strong advisory board that kind of helps me. We have some strong people, folks that work with Teladoc, for example, and so that kind of help us with our technology, and that actually really helps to keep on innovating. Innovation, if there's an issue, you have to innovate, and there's always a better way to do it. It's just you need to have the right team and the right motivation to get it done. Our CIO mentioned something amazing, recently, and I'm going to completely butcher it, but he said something along the lines of, fun, in our whole project for the last 2 years, fun is mandatory, and purpose is extremely important, and chaos is embraced, and that's the culture that we've kind of created in the company to propel us in the direction that we're heading right now.
And I guess just a quick comment on that idea. So what always seems to come across, you seem very positive, very upbeat, very enthusiastic, and as you were saying, a lot of physicians are going through burnout and fatigue and stress, and so like having that culture of innovation and having that level of creativity and that enthusiasm, like that's got to be something that's attracting these physicians, attracting your customers. You guys tell us about how do you do that, because that doesn't sound so easy.
I completely believe in complete transparency with clients and partners. I'm not a salesperson. I would say I'm a subject matter expert founder. So, I do have that advantage, I guess, that I can speak the hospital language. I can speak the physician language. When I'm recruiting physicians, they get it. They understand the value. And it's very easy to kind of explain to them, hey, a lot of, yes, we need in-person care. That's not going away, but that 20 to 40% of care that can be provided virtually, they understand that they like the mission, and plus it gives them a quality of life as well, that they don't have to be driving to several different hospitals, and they can be if they would like, but with us they're at home, they have kids, and they want a better quality of life. From a hospital setting, they understand it as well, because I know how you have to kind of speak in numbers, you have to demonstrate the ROI and the benefit. But all of that, at the end of the day, everything amounts to, hey, patient care. What are patient outcomes going to be? If you are providing a service that specialty services to these rural hospitals and community hospitals that have never seen a specialist before, or never had a specialist before, that's automatically, just off the bat, increasing the quality of care at that hospital. And that goes a long way with patient outcomes. It goes a long way with patient retention, and that's one of the things that people get, and technology is a big piece of it. So that's why it's been a little, in the beginning it was difficult, but because we're in the middle of the pandemic. But now they're realizing that, hey, this is a huge value, that if done right, right, because that's also another, if it's executed right, basically.
Yeah. So on that one, so I love that. That is spot on. Focus on the patient, focus on the quality of care, all that focus on the right priorities is awesome. But then you just mentioned the word value. So I know what we like to talk about with thought leaders like yourself is this idea of patient-centered, value-based care. But then value-based care ends up causing a negative sometimes with physicians because it's not a clear concept. I guess tell me a little bit about how you're thinking about value-based care versus fee-for-service and how it applies to your scenario with LiveMED.
It's an interesting concept, and everyone is talking about value-based care. It's just like a trigger word for the issue that happens is that the way our model is that when you see a patient, you want to treat him appropriately, and the most appropriate and standard of care has to be really, really high the first time you see the patient. What I mean by that is that if a patient's coming into the hospital, and let's say he's coming with chest pain, for example, and he does not get seen by a cardiologist, he may have several other visits to the hospital because he has not seen a specialist. But adding that specialist to the first encounter may prevent him coming back to the hospital, will increase quality outcomes. So when it ties into value-based care, that helps. It's more of like an overall benefit to the hospital, overall benefit to the health system, that you're preventing more disease, you're preventing morbidity by providing the specialty access at an earlier stage along the disease, rather than, you're coming in at, when everything is failing, and then you get the specialist involved, and then that's not going to get you good outcomes. You want to involve specialty care where it's needed at an early stage.
Yeah, and I love that. That's perfect because I think that's the distinction between how you would approach focus on the patient and delivering value, in the sense that, you've got aligned incentives and you've done trade-offs and you've taken advantage of opportunity costs, as opposed to way some reimbursement model defines it, right? It's a whole different thing. Like, set that aside, focus on the patient, make the most of that encounter, and that sounds great. I love it. I wish. And that's kind of like you were talking about earlier, all this resistance to change, they've always done it that way. I mean, it just seems like that's so intuitive that it should be that way, the focus on the outcomes, but it's not. Like, the day-to-day isn't like that, right? It's very challenging.
It's very interesting that you say that, because we've never really focused on, value-based care or like fee-for-service models or compensation models. We've just said, hey, how are you going to treat the patient better? How are you going to get better patient outcomes? And then we, everything else just follows after it. But primarily, that's your goal. And then whatever, you need to do to make that happen, it just follows after. That's our philosophy currently.
Yeah, and I think that's just so important to design, right? You're focusing on the mission. The mission, it's clear, and you're focused. That's wonderful. Thank you.
I wonder if you could elaborate a little bit more, especially as we're migrating toward value-based care, about the measurement of success and the calculating a compelling ROI for these engagement projects. How does that look today, and how might it evolve over time? And some of these benefits obviously might be more soft in nature.
So primarily, at the end of the day, when you're providing services, as I mentioned before, that initially they weren't available to these patients or these communities, one of the biggest KPIs that we focus on is obviously patient outcomes and patient satisfaction. We focus on length of stay at the hospital. Hey, how long was the patient stayed? But out of all of that, we focus on how many transfers were prevented that, without using virtual care, that would have happened. So transferring from these smaller hospitals to larger hospitals is a very, very costly endeavor for these smaller hospitals, and they lose patient retention. And so one of our biggest our value props or ROIs is to the hospitals, like, hey, we're going to prevent this amount of transfers per week or per month, and then patient satisfaction after that. Those are the two main things, but there's also several KPIs, but the two main things are, hey, how many transfers are we preventing, and what are the patient outcomes look like so far?
I think you also mentioned me in some offline conversations about, especially in how you guys are using virtual care and reducing cost of transfers and keeping the patient within the health system.
Exactly. So when we have a virtualist or virtual specialist evaluate the patient, as I mentioned in my example earlier, patient may not need to be transferred to an outside town or a tertiary level hospital. He can actually stay in that same hospital being treated by a specialist virtually. So that's what I was alluding to at that time.
Great. Keith, do you have any final thoughts before we kind of wrap things up?
Well, just really appreciate Dr. Siddiqi joining us, and really loved your insights. And so I think just a couple takeaways. I mean, that just from a leadership point of view, some of the things you're doing. So you're empowering your team, you're delegating responsibilities, you're kind of fostering a sense of ownership and accountability across your entire organization, you're encouraging innovation, you're providing opportunities for everybody to contribute their ideas and their expertise to that innovation. You're leading by example. It's very inspiring to see what you're doing, and your vision and your values and your enthusiasm are really to be commended. It's really impressive. So thank you so much for all that.
Thank you, Keith, for the kind words. It's been a lot of fun. If you're having fun, that's just, you're doing good and you're having fun. That's all that matters.
Well, Dr. Siddiqi, thank you for sharing your insights. During today's webinar, Dr. Siddiqi explored the future of virtual healthcare. He identified how we can use virtual technology to enhance patient care. He discussed with us about deploying digital strategies and improving outcomes, and also overcoming operational barriers to incorporate a culture of innovation. And lastly, covered implementation strategies for change management. Now, our discussion kind of aligns closely with the results of Spyglass's latest study on digital engagement we published last year. For those of you not aware, Spyglass is a product and go-to-market advisory firm focused on disruptive technologies and growth opportunities within the healthcare and life sciences industries. We have more than 250 customers who are leading technology companies, consulting organizations, and healthcare providers. We've published more than 30 market research reports on a variety of different informatics-related topics. So to explore our extensive library of paid research and gain a deeper insight in how technology is reshaping healthcare, I encourage you to go to my website at www.spyglass-consulting.com. Well, Dr. Siddiqi, I'd like to thank you for sharing your valuable insights and perspectives, and to our sponsors, Storage Systems and Simplify Medical, who made this conversation possible. Dr. Siddiqi, would you like to provide any closing remarks today for our audience members?
Definitely. I think I believe we're at a very, very exciting time when it comes to digital healthcare. I believe that we're just getting started, and we're getting to the surface of what could be potentially a very huge transformational change in how healthcare is delivered. And we're just excited to hopefully shape it and be a part of it.
Keith, any additional thoughts on today's webinar?
Well, just thanks, Dr. Siddiqi. Hope you'll come back in the future. And I guess, how do people learn more about LiveMED? Tell us about that.
They can go to www.livemedhealth.com or find me on LinkedIn. There's a lot of stuff for us on LinkedIn, or they can just call us from our website as well.
Well, at Beyond the Blueprint, we look forward to continue our conversation with you in future episodes of this series. And Dr. Siddiqi, I definitely want to have you back to explore this topic in greater detail in the future. So thank you very much.
Thank you for having me.
Thanks,
We're
everyone.
glad to be back. Take care, guys. Have a great
Take care.
weekend.
Bye-bye.